Hi, I'm Ralph.
And I'm Sherry.
We are clinical pharmacists here at Dixie Regional Medical Center. We manage an anticoagulation clinic that provides monitoring services for our orthopedic physicians' hip and knee replacement patients, and for patients who have experienced a hip fracture and require surgery to repair it.
Before you are discharged from the hospital, we would like to review with you what is expected of you as a patient of our anticoagulation service.
Now, hopefully, you were able to attend our pre-op class, where we introduce you to our service and explain to you why your doctor is prescribing anticoagulation after your surgery.
Also, in the pre-op class, you should have received a brochure about Coumadin and our anticoagulation service. If you are a hip fracture patient, you will receive a brochure prior to your discharge from the hospital.
Let us quickly review for you how your anticoagulation therapy will proceed. First of all, your doctor has prescribed Coumadin, its brand name, or warfarin, its generic name, for you to take from 2 to 6 weeks depending on your doctor and the type of surgery that you have had. Coumadin is commonly referred to as a blood thinner, and you will take it to help prevent blood clots from forming, which could potentially be life-threatening.
For those of you who were taking Coumadin prior to your surgery, our service will follow you for 2 to 3 weeks. Then we will refer you back to your primary care physician for further care. As we instructed you in our pre-op class, Coumadin is generally taken once a day. We prefer that you take it in the evening sometime after 5 p.m., but take it at the same time each day.
As you know, each morning of your hospitalization, you have had a blood test to check your PT-INR, and based on this, we have been titrating your Coumadin dose to an amount that will raise your INR to a range of between 1.8 and 2.5. The PT-INR is a measure of how well your blood clots. It is important that you take Coumadin exactly as directed by your anticoagulation provider.
If you forget to take a dose of Coumadin, you should take the dose that day as soon as you remember. If it is time for the next dose of Coumadin, do not take a double dose to catch up. You can call your anticoagulation provider and get his or her recommendation as to what to do, or continue your dose as previously directed. But be sure to tell your anticoagulation provider about a missing dose and when you missed that dose when you next talk to that provider. There is no penalty for missing a dose. Be completely forthright with the anticoagulation provider to ensure that they make dosage adjustments based on all the information.
Coumadin, like any other medication, has side effects, but the side effect that most concerns us is any sign of bleeding. Coumadin is a blood thinner, and it does put you at risk for bleeding. Also know that those who take Coumadin tend to bruise more easily, so avoid bumping into solid objects. Avoid power tools and sharp knives while taking Coumadin, or engaging in extreme activities that could cause serious bleeding. Nosebleeds are not uncommon for those who take Coumadin. Using a humidifier or saline nasal spray will help prevent nosebleeds. Avoid vigorous brushing of gums, not your teeth, while on Coumadin.
Call your physician if any of the following problems occur while you are taking Coumadin: a rash or hives, evidence of any form of bleeding such as pink-tinged, red, or dark brown urine, red streaked or black tarry stools, bloody or dark coffee grounds, sputum, or vomit, bruising over a large part of your body, nosebleeds that will not stop, headaches that are not relieved by Tylenol or other pain relievers.
Coumadin has many potential drug interactions, both with prescription and over-the-counter medications, notably with fish oil, glucosamine, vitamin E, and other herbal products. Your dose of Coumadin has been adjusted based on your present medication regimen in case there are any drug interactions occurring. However, if you start a new medication, please contact your anticoagulation provider at 435-251-2400 to inform them of any changes you have made to your medications so they can make an assessment of any potential drug interactions and perhaps change your Coumadin dose.
You should continue to avoid aspirin and aspirin-like medications such as naproxen or Aleve, ibuprofen or Advil, diclofenac or Voltaren, and meloxicam or Mobic. These medications can increase the likelihood of bleeding while taking warfarin or Coumadin.
Alcohol is also considered a drug and has a potential drug interaction to cause internal bleeding. Please use moderation if you choose to consume an alcoholic beverage. Remember, 1 beer is roughly equivalent to 1 shot of liquor or 1 glass of wine. If you must drink, please limit the amount to 2 drinks a day.
Also has some food interactions. This interaction is due to the vitamin K content of the foods. Vitamin K has an anti-Coumadin effect. If you eat foods high in vitamin K, you will require more Coumadin. We ask that you limit your consumption of vitamin K foods such as leafy or green vegetables like leaf lettuce, spinach, broccoli, cabbage, avocado, asparagus, etc. Split pea soup and any organ meat such as liver or liverwurst. Please do not eat kale.
Some beverages can affect Coumadin. Green tea, which is brewed from a green leaf, has an anti-Coumadin effect. Cranberry juice is usually not a problem with Coumadin unless you drink large quantities. Grapefruit juice should not be consumed.
Who will follow up with my warfarin or Coumadin therapy once I'm discharged from the hospital? Your physician may order the services of our anticoagulation clinic, which is staffed by Dixie Regional Medical Center pharmacists. If he so orders, you will meet with a pharmacist prior to your discharge from the hospital in order to make sure you have a supply of warfarin or Coumadin, a way to test your PT-INR, and a viable phone number for contacting you.
Your lab work will need to be done once or twice a week depending on your need. You should expect a phone call from our anticoagulation clinic on the day of the lab test if you are at home. Please write down any dosage instructions that you are given and follow them closely. We recommend that you use a calendar for this purpose. Remember to go in for your next lab test. If you are at a care center or rehab unit, the anticoagulation clinic will coordinate your care with the nurses at your facility.
Here are some specific instructions for you to remember as you take your Coumadin. Inform all healthcare providers, including other physicians and your dentist, that you are taking warfarin. Before having any kind of surgery, including dental procedures or emergency treatment, tell the physician or dentist that you are taking Coumadin. Do not take aspirin unless your physician instructs you otherwise. When starting or stopping medications, check with your physician or anticoagulation provider. Avoid drastic changes to your diet. Please check with your physician or anticoagulation provider before starting on any extended trips, as this might influence your medication availability and or scheduled PT-INR tests and changes to your diet, which may affect your Coumadin therapy.
Because of the potential for drug interactions, do not take any new prescription or over-the-counter medications or supplements, including antibiotics and vitamins, without first checking with your anticoagulation provider. Report any signs of bleeding to your physician.
Report any signs of calf pain or shortness of breath to your physician immediately.
Go in for your PT-INR, that's your Coumadin lab test, as your physician or anticoagulation provider instructs. Though quite rare, if at any time you experience severe bleeding, go to the nearest emergency room. If you do not hear from your anticoagulation provider by 5 p.m. on the day of your blood test, please call them for your Coumadin dosing instructions. You may have questions after viewing this presentation. Before you are discharged from the hospital, a pharmacist will contact you to answer your questions and arrange for a prescription as well as your blood testing.
We appreciate your willingness to follow the directions presented in this video. Meanwhile, we wish you a speedy recovery from your orthopedic surgery and hope your experience with Coumadin will be satisfactory.